Hello everyone, I'm Raffy Tan, who will discuss to you the vignettes about children and youth who are blind or have low vision. Before I start, the following vignettes and success story about young people who are blind or have low vision illustrate that a disability needs not to be a stumbling block in acquiring an education. Meaning, hindi dapat maging gamiting rason ito or gamiting rason ang kanilang kahinaan, kapansanan para ipagkait sa kanila ang edukasyon. Maraming mga paraan na pwede natin gawin as educator, like other modalities or ways na ma-meet yung needs nila. So bago tayo magsimula, tahakin muna natin kung ano nga ba ang buhay ng isang bulag, paano nila nakayanan ang mga pagsubok na naging inspirasyon sa lahat ng tao. So this story entitled Losing Your Eyes, Gaining a Purpose by Lesther Nana, a real story of Minnie Juan. So I was being motivated after reading the story of Minnie Juan dahil isa siyang bulag since she was poor. Pero sa kabila ng kapintasan ng buhay, hindi ito naging rason sa kanya na graduate as a college valedictorian. Imagine that. Knowing the odds person, she made it her mission to inspire visually impaired children to set their sight higher. So Minnie attended a regular elementary school and other non-disabled children. Her parents, Angela and Maria Lilia, both doctors, had wanted her to experience a normal childhood. But the road was more challenging for her. After regular classes at Virgen Milagrosa Child Learning School in the morning, Minnie took Braille classes in the afternoon. Hindi rin mawawala sa kanya ang ma-discriminate, tinatawag na lampa, bulag, but that does not stop her dreams. Hope that you get motivated as we voyage the topic of blindness and low vision that covers the following topic.
Number 1. Vignettes about children and youth who are blind or have low vision. Number 2. Blindness and low vision to be discussed by me. Number 3. The process of normal vision. Number 4. The anatomy and physiology of human eye to be discussed by Mickey Adrian. Number 5. Types and causes of problems of human eye. Number 6. Special adaptation aids and technology for students who are blind and with low vision to be discussed by Miss Dorothy. And the last topic is the education of students with visual disability when a student who is blind or has low vision is mainstream in your class to be discussed by Lesther Nana.
Without further ado, let us start our topic by first defining what are blindness and low vision. So what do you think is the definition of blindness and low vision? So what are blindness and low vision? So there are two general definitions of blindness. The first is the legal definition based on the measurement of visual acuity. So when we are talking about acuity, it is about the sharpness of the vision level ng paningin mo, like gaano kalawak ang nakikita mo. So second definition is totally blind, like wala kang makikita, talagang madilim na yung nakikita mo. So may tinatawag tayo naman na field of vision. Ito yung sukatan na kung saan it refers to the area that normal eyes covers above, below, the end, and on both sides when looking at an object or when gazing straight ahead. Like ang kakayahan mong makita ang paligid mo both left and right eye. Normally, sa normal eyes, ang makikita nito is that it covers approximately at range of 180 degrees. So mura siya parurama. So, there are three classification of the field of vision. First is central field of vision. So, when looking directly at an object, it is used like nakapokus lang yung mata mo, clearly can be seen yung object, walang ano-anong blur. So, number 2 is peripheral vision. Covers the outer content of the field of vision. A person may have flawed central idea but have good peripheral vision, like focus on something na nakikita mo pa rin yung paligid pero parang blur na siya. For example, pag ginatulong mo yung kamay mo, itututok mo sa isang bagay, hindi mo makikita yung paligid mo because it is blurred, because nakatutok lang yung nakatutok ka lang sa particular na bagay, pero kapag inalis mo naman, bumabalik siya sa normal. So the third is ang tunnel vision naman. It is the result from a highly restricted field of vision. It is like looking at the object in the environment through a narrow tube or channel. Diba may pagkakataon na kapag ikaw ay tumayo ka agad, biglang nandidilim paningin mo, para siyang nasa hole na unti-unting dumidilim paningin mo. So, pansinin mo pag ginanito mo yung kamay mo. Diba hindi mo nakikita sa gilid kung ano ang nakalagay. So, may mga ganyan mga instances. Kung ganyan ang naranasan mo, better consult a doctor ahead. The area of the intervention can decrease slowly and detected among over the years. So, mahirap na. So, a complete eye examination should include both visual acuity and the field of vision. So, normal visual acuity is measured by reading the letters, numbers, and other symbols from a chart of 20 feet away. Like, way back in elementary, di ba nakaranas tayo na i-test yung paningin natin through letters like the Snellen chart, na kung saan the letter in the diagram correspond to the appropriate distances where they can be read with normal vision. So, nung elementary tayo, 20 feet yung tinitest sa atin. Paano nga ba malalaman ang pag-test ng Snellen chart? So, paano nga ba? Na-remember niyo pa ba? So, para matesto, kung mapapansin niyo sa chart, di ba may nakalagay na 20 over 200, 20 over 100, 20 over 70, 20 over 50, 20, 20, and 200, 170, and 50. Yan yung mga feet na kung saan mababasa mo ang letter. For example, sa 200 feet ang nakalagay ay letter E. Kinakailangan sa 200 feet mababasa mo pa rin ang letter E. So, when a person can read the row of letters marked 20 over 20, he or she can read the notes that normal visions bring it to be read at 20 feet. On the other hand, if a person can read the row of letters marked 20 over 70 only when placed 20 feet, hindi siya nakaabot sa 20/20, which is the normal eyesight away from the chart. His visual acuity is poor. Medyo malabo na ang kaniyang paningin. So, normally, the larger letters can be read at a distance of 70 feet. Pero if sa 20 feet pa lang, hindi niya na mabasa, meaning sira ang bata niya. Or when a person can read the row of letter mark of 20 over 200 only when sit at 20 feet away from the chart, his visual acuity is so poor that it falls within the range of blindness. Biruin mo ikaw nasa 20 feet, pero hindi mo mabasa yung letter E, na dapat pabasa mo na siya na namang mababasa sa 200 feet. Blindness na yan. Kung titignan natin, nasa 10% lang ata out of 100% to the normal eyesight. So, the legal blindness refers to the condition where the visual acuity is 220 over 200 in the better eye after the best possible correction with glasses and contact lens, whether central or peripheral. The field of vision is limited to an area of 20 degrees or less from the standard of 100 degrees field. So, a legally blind person with their eyeglass or contact lens can see or read at 20 feet object and letter that those with normal vision can see or read 200 feet away. However, not all legally blind person are totally blind. In total blindness, the person is absolutely without sight but may have the light of in movement perception and travel vision. So, the degree of blindness include light perception, movement, perception, and travel visions, although classified as blind. The person can still use his or her residual image. So, that is the cover of my topic. Hope that you have learned something. Comment below if you have any clarification. And thank you.
My name is Adrian Su, and I'll be discussing two topics, which are the process of normal vision and the anatomy and physiology of the human eye. So now, let's start about the first topic, which is the process of normal vision. To understand how certain problems can affect your child's vision, so it is important to know how normal vision happens. So for children with normal vision, the following things happen in this order. So first, the light enters the eye through the cornea. And what is cornea? So this is a clear dome-shaped surface that covers the front of the eye. And then, from the cornea, the light passes through the pupil. So the iris or the colored part of your eye controls the amount of light passing through. So from there, it then hits the lens. So what is the lens? This is the clear structure inside the eye that focuses light rays onto the retina. So next, light passes through the vitreous humor. And what is vitreous humor? So this is the clear, jelly-like substance that fills the center of the eye. So it helps to keep the eye round in shape. So finally, the light reaches the retina. So this is the light-sensitive nerve layer that lines the back of the eye. So here, the image is inverted. So the optic nerve is then responsible for carrying the signals to the visual cortex of the brain. The visual cortex turns the signals into images. So for example, our vision. And now, let us proceed to the second topic, which is the anatomy and physiology of the human eye. But before that, for the anatomy of the human eye, we have here the anterior chamber. So the front section of the eye's interior, where aqueous humor flows in and out. It is providing nourishment to the eye. The aqueous humor, so it is the clear watery fluid in the front of the eyeball. Next is we have here the blood vessels, tubes, arteries, and veins that carries blood through and from the eye. The caruncle, a small red portion of the corner of the eye that contains modified sebaceous and sweat glands. We have here the choroid, so the thin blood-rich membrane that lies between the retina and the sclera, and also responsible for supplying blood to the outer portion of the retina. Next is the ciliary body, so the part of the eye that produces the aqueous humor. Next is the cornea. So this is the clear dome-shaped surface that covers the front of your eye of the eye. Next is the iris, the colored part of the eye. So it is responsible for regulating amount of light permitted to enter the eye. Next is the lens. What is lens? Also called crystalline lens. It is the transparent structure inside the eye that focuses light rays onto the retina. The lower eyelid, so skin that covers the lower part of the eyeball, including the cornea when closed. The macula, so the central portion of the retina that allows us to see fine details. Next, optic nerve, so a bundle of nerve fibers that connect the retina with the brain, and the optic nerve carries signals of light, dark, and colors to a part of the brain called the visual cortex, which assembles the signals into images and produces vision. Posterior chamber, the back part of the eye's interior. Next, the pupil, so the opening in the middle of the iris through which light passes through the back of the eye. The retina, the light-sensitive nerve layer that lines the inside of the back of the eye. So the retina senses light and creates impulses that are sent through the optic nerve through the brain. The next is the sclera, the white visible portion of the eyeball that the muscles that moves the eyeball are attached to the sclera. Next is the suspensory ligament of lens, a series of fibers that connects the ciliary body of the eye with the lens, holding it in place. The upper eyelid here, so the skin that covers the upper part of the eyeball, including the cornea when closed. Vitreous body, it is a clear jelly-like substance that fills the back part of the eye. So next, the last about the physiology of the human eye. We have here the aqueous humor. It is a clear watery fluid in the interior chamber. And what is the function of this? So it nourishes the lens and the cornea. It helps refract light onto the retina. Next, vitreous humor. It is a clear gel-like fluid in the posterior chamber. It supports lens and retina to keep the eye from collapsing. We have here the retina. The cone, it is sensitive to bright light. The rods, it is now sensitive to dim light. The lens. Next is the optic nerve. The optic disc. It is the point where optic nerve enter the retina. The iris. We have here the retinal blood vessels. The arteries transmit oxygen and nutrients. Next is the sclera, the cornea, and the pupil. So, lastly is the conjunctiva gland. So, these layers of mucus which help keep the outside of the eye moist. So, that would be all. Thank you.
Hi, hello, it's Dorothy, and I am assigned to discuss about the types and causes of problems of vision. So the following are the types and its causes. So first, we have eye strain. So anyone who reads for hours, works at a computer, or drives long distances knows about this one. And we are experience this also, especially during online classes. So it happens when you overuse your eyes, they get tired and need to rest, just like any other part of our body. If your eyes feel strained, give them some time off. So our eyes need a rest too. So next is red eyes. This surface is covered with blood vessels that expands when they're irritated or infected. That gives your eyes or our eyes the red look. So eye strain can also arisen, and so can a late night, a lack of sleep, or allergies. So next is night blindness. So some people are born with this problem, or it might develop from a degenerative disease involving the retina, and that usually can't be treated. If you have it, you'll need to be extra careful in areas of low light. So especially when we go to theater, now we will experience this. So next is lazy eye. So lazy eye or amblyopia happens when one eye doesn't develop properly. So the most common cause of lazy eye is an imbalance in the muscles that positions the eyes. So vision is weaker in that eye, and it tends to move lazily around while the other eye stays put. So the next, we have cross eyes or strabismus and nystagmus. If your eyes aren't lined up with each other when you look at something, you could have strabismus. So you might also hear it called cross eyes or wall eye. So the risk factors for developing strabismus includes family history. So the next, we have color blindness. So when a person can see the difference between the red and green, they might be colorblind. So it happens when the color cells in your eye, or the doctor will call them cone cells, are absent or don't work. So most people who have it are born with it, but you can get it later in life from certain drugs and diseases. The next one, we have uveitis. This is the name of a group of diseases that cause inflammation of the uvea. That's the middle layer of the eye that contains most of the blood vessels. These diseases can destroy eye tissue and even cause eye loss. So people of all ages can have it. And people with immune system conditions like AIDS, rheumatoid arthritis, or ulcerative colitis may be more likely to have uveitis. The next one is presbyopia. So this happens when you lose the ability, despite good distance vision, to clearly see close objects and small prints. After age 40 or so, you may have to hold a book or other reading materials farther away from your eyes to make it easier to read. So mostly we can see this to the older people, the way they read. Okay. So next we have floaters. So these are tiny spots or specks that floats across our field of vision. So usually we experience this pag nasa labas tayo at sobrang liwanag, so we can see floaters. Now, so floaters are usually normal, but they sometimes can be a sign of a more serious eye problem like retinal detachment. And if you notice a sudden change in the type or number of spots or flashes you see, or a new dark curtain in your peripheral vision, go to your eye doctor as soon as possible because it's not normal. So the next one, we have dry eyes. So this happens when our eyes can't make enough good quality tears. You might feel like there's something in our eye or like it's burning. So rarely, in severe cases, extreme dryness can lead to some loss of vision. So next we have excess tearing. So it has nothing to do with our feelings, but we might be sensitive to light, wind, or temperature changes. Next we have cataracts. So these are cloudy areas that develops in the eye lens. A healthy lens is clear like cameras. Light passes through it to your retina and the back of our eye, where images are processed. So when you have a cataract, light can't get through as easily. So the result, you can see as well and maybe notice glare or a halo around lights at night. So cataracts often form slowly and they don't cause symptoms like pain, redness, or tearing in the eye. So we have glaucoma. So glaucoma is one of the most common eye problems. So it is the name for a group of diseases that cause this condition. A common form is a primary open-angle glaucoma. So most people who have it don't have early symptoms or pain. So it's important to keep up with your regular eye exam. So it doesn't happen often, but glaucoma can be caused by an injury to the eye, blood vessels, and inflammatory disorders of the eye. So next we have conjunctivitis, or commonly called pink eye. So in this condition, tissues that lines the back of your eyelids and covers your sclera gets inflamed. So it can cause redness, itching, burning, tearing, discharge, or a feeling that something is in your eye. So people of all ages can get it. Okay, so causes includes infection, exposure to chemicals and irritants, or allergies. So always wash your hands often to lower your chance of getting it. So those are the types and causes of problems of vision, and now let us proceed to the aids and assistive technologies for individuals with visual disabilities. So first we have Braille. So we are familiar with this. So it is a tactile writing system used by people who are visually impaired. So it is a system of raised dots arranged in cells, and the number position of the raised dot represents a letter, word, number, or symbol. So next we have screen reading software. So this is a software used synthetic speech to read aloud the content that appears on a computer screen. So next we have magnification software. So it works similarly to a high-powered magnifying glass moving over the page, and they can magnify all screen items. So next we have electronic mobility aids. So electronic mobility aids are devices that use ultrasonic waves to reflect off obstacles in front of the individual to tell them what is coming in front of them. And also we have service dogs. So service dogs are dogs that are trained to help their owner with a specific disability. So really dogs is a big help to those people who are visually impaired. So next we have canes. So there are various types of canes, and most popularly, the long cane can help individuals who are blind or have low vision navigate with confidence. So also we have reading assistants. Reading assistant is an example of software or devices that can help those who are blind or visually impaired read printed materials or surf the web. So the following are the example of it. So we have JAWS. So JAWS Screen Reader, this stands for Job Access with Speech, and is a popular screen reader. It works with Windows operating system and provides text-to-speech and Braille output. And next we have Kurzweil Education. So this is a text-to-speech software that can help those who are blind or visually impaired to use computers, and also can read scanned printed materials. So Kurzweil offers various versions for individuals, schools, and institutions. So that's all, and thank you for listening.
Hello everyone, I am Lesther Nana and I'll be discussing about the education of the students with visual disabilities and student who is blind or has low vision is mainstream in the class. First, what is visual disabilities or impairment? Visual impairment or visual disability is defined as the decreased ability to see to a degree that is causes problems not fixable by usual means, such as glasses or meditation. Visual impairment can be due to diseases, trauma, congenital or degenerative conditions. Visually impaired children may be defined as those children who suffered from impaired conditions, difficulties, and deficiencies present in their vision organs which make them different from the children with normal vision to the extent of requiring special education provision. Now, here are the types of visual impairments disabilities. Number 1 is hyperopia, farsightedness. Number 2 is myopia, meaning nearsighted. Number 3 is astigmatism. A person who has astigmatism, they cannot focus on one object regularly. Number 4 is color blindness. It has a problem with cones cells of their eye. Reason of ability in decreasing to differentiate colors. Number 5 is retinopathy of prematurity. This condition is common children who were premature babies that requires high concentration of oxygen at birth. Scarring and detachment of the retina can result from this condition. And number 6 is macular degeneration, the loss of central vision. Two objects looks one. And number 7 is glaucoma, due to the blockage of the fluids that normally circulate within the eye. And lastly, diabetic retinopathy. And now, let's go to educational provision for visual impairments. Number 1, decision concerning educational placement. Student must have regular classroom, a written and teacher program, resource room program, full-time special. Number 2, decision concerning curriculum, personal competence, self-adjustment and daily living skills, orientation and mobility, communication skills, vocational guidance and career development, use of special aids and equipment. Number 3, concerning curricular implementation, developmental of essential skills for gaining information and knowledge, training in the use of braille system, and provision of low vision aids with necessary training. And now, here are the classroom accommodation for students with visual disabilities. Number 1, welcoming the students. Safety. Number 3, seating. And number 4, assignment and examination. So later, we will have some tips for parents, teachers, and social needs of student with visual disabilities. And now, let's go to the student who is blind or has low vision is mentioned in the class. Visual impairments can result from a variety of causes including congenital conditions, injury, eye disease, and brain trauma, or as the result of other conditions such as diabetes and multiple sclerosis. What is low vision? Low vision in the World Health Organization classifications as moderate visual impairment, severe visual impairment, and visual field loss or loss of peripheral visions. And here are some tips for parents, teachers, academic needs, and social needs in dealing with the students with visual disabilities or impairment. For parents, learn as much as possible about the specific visual impairment. Encourage curiosity and help your child explore. Work with school staff. Talk to other parents. And for teachers, ask to be part of IEP team. Talk to special education teachers about learning strategies. Find the materials or resources needed to support the students. And talk to the students' parents. For academic needs, find out if school has technology needed to help students to succeed in the classroom. Practice auditory skills since hearing will be the primary learning tool. Keep information on braille books available. Practice analytic touch to get a sense of object. And lastly, for social needs, help distinguish between behaviors that are socially unacceptable in public yet acceptable in private. Understand social distance for various communication situations. Make students comfortable when asking for help when appropriate. Showing acceptable social behavior in a multiple of group situation. And lastly, dealing living needs, help understand of basic personal hygiene, dressing skills, preparing meals, practice eating skills, managing money, and basic understand of the time and keeping schedules. And for last, making classroom accommodation. Keep aisle keep of the debris. Notify student if any changes in the classroom are made. Be clear when giving instructions. Allow for extra time to finish assignments. And assign a peer to help in case of emergency. Students with visual disabilities is not easy. We, teachers, must have more patience in dealing with our students for their better learning. Once again, I am Lesther Nana. Good day and thank you.